We're standing outside of the Bob Barkley Study Club in Roanoke, Virginia, and I'm talking to Dr. Brian Vence from Chicago, Illinois. Brian has been here for a day and a half in this seminar. So let's talk about yesterday, where people were going through their practices and talking about CoDiscovery and how they implemented it. You were one of the speakers. What was your takeaway from listening to the other folks that were describing how they're doing CoDiscovery?
Well, CoDiscovery is something that's being utilized in a lot of different practices. Everybody has their own spin on it, but it's equally effective. It doesn't have to be done a certain way. It just has to be done your way.
Right, right.
And your way needs to, I think, basically get to address what the patient's vision is of how they want to be taken care of.
I was surprised at the major differences in how people approach this and effective with it.
Yeah, well, people are different. You know, different practitioners have different experiences, and they attract different types of patients.
Right, and it's all about listening and responding so the patient can tell you what their desires are.
However, that you as the practitioner have to be able to kind of clear your prejudices or your prism so you can actually hear what they're saying.
I don't understand. Explain.
Well, if I've got, sort of little prejudices in my past as far as certain experiences that make me hear things a certain way, I might not be clearly hearing your message. So it's as important to be able to listen to the patient, but before you ever start listening to the patient, you need to listen to yourself, and even in the ongoing conversation with the patient.
Did you have to learn to do this?
Only 37 years.
Oh my, 37 years. How did you accomplish learning to do that?
I'm still learning how to do it. It keeps surprising me what comes up, but I've worked with Avram King, who did some nice workshops on something called Knots and Knots, getting your family of origin issues. I did psychotherapy for 3 years, 3 days a week with Dr. Melendez out of Arizona, who is a student of Eric Fromm in self-psychology, and still wasn't really sinking in. I actually had the experience of going through divorce, which made me have a lot of introspection during that time. And then, got involved with Freddie Weaver and Elsbeth Muth, who have a company called Bring Forth that have some meditation practices that allow you to kind of calm and listen to what's coming up. Mm-hmm. So it's been a long time, but it's been nudged along more and more, each year.
Why? Why were you driven to do this?
I felt like there was something that was getting in my way. And I think, it was basically, not that I had an idyllic childhood, really. It was Mayberry RFD, but still, even though you have a good childhood, and you've got good parents, maybe they don't have all the skills to raise you as an individual. And then you have to, after age 18, develop your own skills to raise yourself as the individual that you want to be.
And some people just seem to be gifted at listening and understanding people.
Yeah.
I wasn't one of them.
I wasn't one either.
No,
but I think it is something you can learn. It's probably a learned behavior when you're young to not listen to yourself. Because of what's going on.
Probably, yeah.
And any learned behavior can be unlearned and replaced with a new behavior.
Yeah.
Yeah.
Did this impact your dentistry in a gradual way, or was there just a breakthrough and wow, now I got this figured out?
Never really a breakthrough, got it figured out.
Yeah.
But little by little, not accepting certain ways people treat you and things like that probably gradually attracted better people to the practice as far as staff and patients to have more of what might appear to be a breakthrough from the outside.
A long path.
It is a long journey.
Yeah. Now today there was new technology talked about. There was talking about the microbiome of the mouth, about sleep apnea, and about things that dentists have traditionally not participated with.
I think the last speaker that was talking about the sleep medicine and brought up complicated versus complexity. I think a lot of these things that we're talking about in the microbiome and in the sleep world, even in our restorative world, are things that are complex, issues that need to be worked out. CoDiscovery, I think, certainly helps us work that out with the patient. And so, I don't, I don't know that all the stuff that was talked about today is actual fact. It's kind of something that's interesting, and I need to explore further and find out what's actually evidence-based and what's not. But it certainly provokes the thought and thinking
Yeah.
of what might be different.
Yeah, it was interesting. Yeah.
Very interesting.
Now,
Yeah.
you've got a very productive and active practice, so you were a speaker, so you could say, I came to this because I'm a speaker and got invited, but I think it was deeper than that. I mean, why do you come to these things?
I mean, I always like the thought-provoking, speakers that, Paul ends up bringing, even though I may not buy into it right away or maybe ever at all. But it's, I like to see different perspectives. But more importantly, I have hired, since the pandemic, 3 new team members, and they hadn't been involved in any of the, like, we had done some workshops back at Medina. You were at Medina recording Paul and I doing the CoDiscovery workshop there, right? And all those people that I had before was pre the pandemic. Okay,
Right.
Since then I've hired 3 new people. I have.
Yeah. So they don't know.
They don't know, and I wanted them. I mean, they see it in my office, right?
Yeah.
But they don't see that it's a real thing out there that other people are exploring and trying to learn how to do.
So
better.
you brought some of these team members. Are you seeing an understanding, a glimmer of what's going on in their eyes?
We'll find out.
Okay,
I got a plane ride.
There you go.
Back,
Yeah,
and I've got a whole next week to start talking about it and stuff. But it's definitely gives us a shared experience around CoDiscovery, and then maybe a way that they can feel more empowered to not just follow my lead, or Lynn's lead.
Yeah. Well, somebody is watching this video, hopefully.
Yeah.
And they're saying, why go to Bob Barkley Study Club of all things? Never heard of the guy in Roanoke, Virginia. What would you say to them?
I would say if you feel stuck in your practice and you're looking for a way to kind of break free, the path to that is personalized dentistry with patients, so they can get a personal vision of how they want to appear and how they want to eliminate risk to future problems. And that's sort of the way you can break free of the shackles of insurance, because when people have that, they want to attain their personal vision, and they're not really that concerned about what some bureaucrat thinks somewhere else about what their health should be. And so you can be free to charge what is appropriate for your services and actually take care of people and really help people, because we don't really fix people, we help them fix themselves.
Powerful. Well, if this intrigues you and you're watching and you have not been to the Bob Barkley Study Club with Dr. Paul Henning, I encourage you to look at some of the videos, the testimonials of people such as Brian Vence, who say, yeah, this has been valuable. So thank you. Hope we see you here at one of the Bob Barkley Study Club meetings.